Hello everyone, I'm Dr. Abdullah Faris, head of the scientific committee at the American Academy of Developmental Medicine and Dentistry, the AADMD, and I'd like to start by welcoming you all to the second episode of our campaign AADMD Talks, where we'll be having a series of interviews with specialized doctors and parents regarding several topics that require more attention and more awareness, and answering your most frequently asked questions at the same time. Now, today's topic is a bit broad, but we'll be aiming at covering most of its important aspects, as well as answering all of the questions that you asked us with our guest today. So our topic today will be about the autism spectrum disorder. And for this episode, allow me to introduce our guest, board certified and international behavioral analyst, as well as founder and owner of Autism Intervention Specialists in Dubai, Dr. Bahij Khuzami. Dr. Bahij, how are you?
I'm good. Thank you so much.
Thank you so much for attending this interview today. It's an honor.
Thank you so much. I'm glad to be here.
Thank you. Okay, doctor, so we have prepared a list of questions asked by our Instagram followers. We'll be going through them one by one. So we'll start with the first question.
Sure.
So for the first question, doctor, can you briefly just give us, in your own words, like what are the different levels of autism spectrum disorder for those who might not be very familiar with the disorder?
Yes, absolutely. So in short, there are 3 levels of autism, level 1, level 2, and level 3, which they are also could be described as mild, moderate, severe. So level 1, the person needs very minimum support. Level 2, they do need some support. And then level 3 is the highest, which they need support basically all of the time. Sometimes some of the kids, some of the individuals, they do receive mild to moderate diagnoses or moderate to severe kind of diagnoses. So that, in short, those are the 3 levels of autism that somebody can have. If you want, we can go a little bit more in details about how we move from level 3 to level 2, then to level 1, so they can receive the diagnosis. Would you like me to talk about this?
Sure. Go ahead, doctor.
Sure. So we have seen, I have worked a lot with kids, especially on the early intervention, between 1.5 to 2 years and 5 to 6 years old, where before they receive any type of diagnosis, there are some signs of autism, which I believe is one of the questions, so I'll leave that to later. The kid shows very severe skills and severe behaviors. So when we work with early intervention, we improve, we develop more skills so that they are not diagnosed at level 3. They get the diagnosis of either level 2 or level 1. So with early intervention, with proper programming, with proper treatment, they can move from the level 3 to less levels so that they don't receive level 3. Like I am working currently with several parents in my center where their kids are severe. And if they go for a diagnosis, they will get the level 3 severe autism diagnosis. So they want to wait at least for 3 to 6 months before they go for the formal or the official diagnosis, so that while we're working through these 6 months, the symptoms and the signs will reduce and they will not receive the severe autism diagnosis.
Yeah.
I will leave it as short as that.
Yeah, I think we'll be discussing it more with the coming questions.
Sure.
Okay, moving on. For our second question, what are some signs of autism to look for in my 1.5-year-old child? Or let's just say in general, if a parent suspects that their child might have autism, what are some things to look for to confirm like an initial diagnosis from the parent's side?
Excellent question. And this question can save the life of a kid, technically. I am currently outside UAE, and I have met with someone, a parent and somebody who is in this field. as an association, and they have a kid who's 16 years old, and because they missed the signs of autism, and there was at that time not proper services and treatment, now the kid is basically without skills, problem behaviors, because those signs were not addressed at the early age. That still doesn't mean that he cannot improve. He can. However, the bulk of change is better when the kid is a little bit younger, and we'll talk about this later. However, now the signs that to look for are pointing. So by 1.5 to 2 years, definitely, all kids, we're going to address typical kids. We're not going to say normal kids. We're going to use typical kids in this meeting. So we're going to say typical kids. They do point definitely by 1.5 to 2 years, and they start using their index finger in this form and shape. So they will say, I want this, I want that. So pointing is one of the milestones and the signs to look for. I'm saying that speech and language delays,
Yes,
if they are by themselves without any other signs or symptoms, that is something that will be discussed or will be assessed on a separate assessment with different professionals. If the speech delay is combined with the other signs, then everything should be taken into consideration regarding that. The third sign is excessive tantrums. All kids, they have tantrums. Even us adults, we sometimes have tantrums. We get angry. We have road rage.
we do.
All have tantrums. We all have tantrums at some point. But with kids on the spectrum or showing signs of autism, it's the frequency is and the duration is what makes the difference. It's very long. It takes long. And it's very frequent. It happens like almost all the time during the day. So that's the third sign to look for. Not responding to name. This is where first thing we ask is, did they go for a hearing check? If they said yes, everything is fine, then we know that they're hearing. It's not because of any loss of hearing or anything. The fourth sign is playing behaviors. So we see that they are more engaged with toys rather than with other people or other peers. Also, for example, if you give them a new toy or someone gives them a new toy, do they share that excitement of something new with their parents? So let's say their uncle came in and then he has a new toy for the kid, and the kid picks it up and then just looks at it, throws it, and then walks away. Or he plays with it by himself. He doesn't go to his parents and say, hey, look what they got me. No need for these words, but going to the person, showing them that this person got me something. This is what I'm trying to say to my parents. Oh, look what he got me. It's a very nice gift. Look at this. I want your affection. I want you to look at me and show me that interest. So if that is missing, that's also another thing to look for. They play with a repetitive kind of a way. Playing behavior is very, very wide.
One of the signs that people usually look for when trying to diagnose their kids, maybe initially with autism, is that they might have repetitive movements, specific patterns of like repetitive phrases, repetitive movement, hand gestures. So yeah, this is another sign, the repetitive movements or the specific patterns of food, for example.
Correct. So we all engage in repetitive movements. When you're sitting and you're doing like this, or if you have something in your hand and you go like this, those are all repetitive movements. If you're sitting on the table and you do like this, those are all repetitive movements. With typical people, however, they can control it, they can stop it, they can say to themselves, okay, well, don't move.
I won't do it anymore. Yeah.
Exactly. But kids on the spectrum, they do it more. It's the frequency of them doing it is what will give them that type of diagnosis. Food selectivity, that's a whole different area with autism as well. So repetitive behaviors is our 3, 4, 5, our 6th sign. Insisting on the same. They want to go the same road. every day. They want to take the same road to the school. If you go to a different road, they throw a tantrum. They want maybe the same blanket. They want the same object. They want the same cup. They don't drink or eat from any other cup or plate except that one. Sensory issues. We all know about sensory issues with kids on the spectrum, whether it's auditory, it's the sounds, or the smell, or the taste, or the touch, or the visual sensory issues. Like somebody who looks from the corner of their eyes, those are visual sensory stimulation. Motor delays and toe walking is another sign. When you see a kid who has low motor functioning, they can't walk properly, they can't use their fingers properly, and toe walking also is another sign to look for. And the last one is imitation. We learn by imitating others. If you let's say go for like a yoga class, okay, you have never done yoga in your life, what are you going to do? How are you going to learn? You're going to look to the instructor, and
yes,
they're gonna model some pose for you, and you're gonna imitate the model, and that's how you will learn. Same thing with kids. They learn through imitation. They see their parents, let's say, reading a book. Maybe they will get a book and they will see that and they will get it. Also, I have seen a video on Instagram. It's a funny video. The mother is pregnant and she holds her back and she walks like her back hurts. She has a kid. He does the same and he walks up to her and then he goes like this to her. That's imitation. You know, people say it's a cool video. It's very nice. It's all that, but it is imitation. So when those skills are lacking, and especially imitating other peers, let's say in the nursery, if they go somewhere with other kids or peers, let's say in the mall or playground, kids learn to go through the slide when they see other kids sitting and going with the slide.
Yes.
A kid on the spectrum might not know what's going on, or he might not follow others what they're doing. So I'll keep the imitation part only to this. Maybe also limited babbling, smiling, attention towards faces. So now in the States, they have machines where they can recognize if the kid has autism up to 6 months of age. Because of these machines, when they see if they're looking at the eyes of the person, that means he's not more likely to develop autism or to have autism. But if the kid or the infant is looking around the face of the person, he will be or she will be more likely to have autism later on when they are 1 year and a half, 2, 3 years old.
Yes, that's great. Okay, so moving on to our next question. Is there a link between Down syndrome and autism?
Yes, the short answer is yes. There is a link between Down syndrome and autism. So the percentage is somewhere around 16 to 18% of people with Down syndrome, they also have autism.
That's a high percentage. That's a
yes.
high number, yeah.
Correct. And sometimes it's very difficult to diagnose autism when someone has Down syndrome, and especially when it is comorbid with other disabilities as well, like intellectual disability and other like ADHD and other stuff. But Down syndrome can be detected before the kid gets born, but autism, they can't detect it before the kid gets born. So the kid has to be born first, then they can tell if he has autism or not. With Down syndrome, they can find out from the beginning if the kid has Down syndrome or not. That's why genetic testing is very helpful to recognize that. But yes, there is a link between ASD and autism.
Okay, doctor. So for this question, they asked you, if I suspect that my child has autism, do I have to immediately seek help from a professional? Because something we see nowadays is that when parents suspect that their child has autism, they go through a phase of, let's say, disbelief or denial. no, my child doesn't have autism. So would you advise these parents to, if they find any signs, to just quickly and immediately go and seek a professional help, medical help?
Absolutely yes. Absolutely yes. Because the time that passes, you can't get it back.
Exactly. Yeah.
And at that age, the brain is still malleable. It's still it's like a sponge, right? You will hear a lot of professionals saying that. It's like a sponge. I'll go a little bit more deeper with technical words. The neuroplasticity in the brain is at best to change at that early intervention stage, between 1.5 years to 5-6 years old. That time is very critical to receiving the proper therapy, not any therapy, the proper therapy, so that we can change the neurons in the brain, how they fire up. And I have seen this in my practice for almost a decade now. We are changing the neurons of these kids. I'm currently working with a family. Their kid is 3 years old. 6 months before, he was completely out of it, if I might say that word. He's nothing. No receptive language, no expressive language. You tell him something, he doesn't. It's like no one said anything because he doesn't understand. Now you can tell from his eyes, from his face, from his movement, from him listening to you, that something changed. That means the neurons are building up. They are improving, especially with imitation. We have something that is called mirror neurons. And mirror neurons in kids with autism, the research has found that they are not broken. It's not like they that's it. They don't have imitation skills. That's it. We're done. Okay, let's stop doing everything. No, you can build them up again until the kid is fully functional regarding his imitation repertoire. So it's not like, okay, he lost it, he can't get it back. Mirror neurons, they can be built up with proper programming, with the proper experience, because not all chefs, they are good chefs. Not all drivers are good drivers.
Yes.
You know, and that goes to all other professions. So not all professionals who work with kids on the spectrum, also they are good. Not all certificates or clinicians, they know also. That's why expertise from everything, the knowledge, education, everything like any other profession also works in working with kids on the spectrum as well.
Yeah. Okay, so this was actually asked by a lot of our followers. Can autism be totally cured with medication?
Okay. The answer is no.
Yeah.
As of yet, there is no medication or any other type of a treatment that can cure autism. The best we can do at the moment is to improve the symptoms, is to improve the quality of life of these individuals and these kids. I will give you a very short example from my own practice and experience about improving the life of all the kids that we work with, but specifically this kid. The kid is almost a teenager, and the family went a family dinner or went outside all together or even sat at the table dinner as a family. Because the kid is very aggressive, and whenever somebody is around, especially his family members, because of the previous history with them, everything gets destroyed and everything goes to the floor. People gets on the floor. It's a disaster. So after working with this kid for quite some time and giving him the proper approaches, now the kid is able to sit with his family member for the first time of his life, travel with them on an airplane for the first time of his life, going outside with his parents without 2-3 people being with him for protection, safety, and for other reasons. Now the parent by themselves, they are taking the kid with no issues, sitting in the restaurant, having dinner, lunch, whatever, coming back home, zero problems. So did we improve the quality of life of the kid? Yes.
Yes.
Does he still have autism? Yes, definitely he still have autism. We didn't cure it. We didn't eliminate it completely, but we did improve his quality of life from how it was before. So that is also that's we need to recognize these successes for us and for the parents, because nobody likes, and I've seen a lot of diversity of parents from different culture and nationalities across when I used to be working and living in the States and then moving here to Dubai. All parents, nobody wants to hear that their kid has any kind of disorder or disability or illness or whatever you want to call it. Nobody wants to hear that.
Yes.
The more you deny, the more you don't accept it, the harder it will be to receive the proper intervention and the proper improvement. And this will fall on the kid, not on the parents. It will fall on the kid because he's the one who's losing all this time, or losing at least some of this time.
The more you delay treatment, the harder it gets to treat the...
Absolutely.
Okay, so yeah, just to add on from that question. So as you've mentioned, what are the different treatment options that we have? And has one shown to be better than the others?
This is actually a reel that my marketing team is preparing for me to do, is about treatments and evidence-based treatments and fade treatments. If you Google treatments for autism, maybe more than 6 million pages will show up
yes.
on the treatments of autism. And I have heard and seen so many strange ones where like some voodoo things and some oils and some smoke coming up and then circles and different beliefs, different cultures, different these things. However, not all these are scientific. They're not evidence-based. They don't improve the quality of life of the kid. They don't improve behaviors. They don't improve skills. What does improve and has been shown to improve everything we just mentioned is something that is called applied behavior analysis, which is the science of human behavior. And this is an adaptive science and not a social science. That means it's related to a person specifically, not about changing the culture of a country or a community. It's not that. It's improving socially significant behaviors that are related to you as a person. Can you reading, let's say, taking shower by yourself. Who's going to benefit from that other than you, the person? Washing your hands, hygiene, a lot of skills, making food. A lot of these things can improve and can be done through this approach that is called ABA. There are a lot of programs that are based on that principle, such as discrete trial training, early intensive intervention, EIBI, early intensive behavioral intervention. We have pivotal response training. We have the Early Start Denver model. There's a lot of them that are based on the principles of ABA. We are actually launching a new program called Ignite at AIS that is also based on the ABA principles for school readiness, kids who want to go to school, but they're having some problems at being admitted to school or getting them ready to school. So ABA is the prescription that when you go to the States, okay, like when I was there, you go to the diagnostic doctor, neurologist, or a pediatrician specialized with autism, because not all of them, they know how to do it. And not all psychologists, they know how to deal with or work or diagnose kids on the spectrum. They have to be specialized in autism. So how it goes is that the parent goes to the doctor, they get the diagnosis, okay? After the diagnosis, the doctor will prescribe as a prescription ABA as a treatment. So just like when he prescribed to you some medicine that you go to the pharmacy and you buy, the doctor is there, they prescribe ABA as a treatment. Of course, there are ABA, speech therapy, occupational therapy, and physical therapy in some cases if it's needed. those are the evidence-based treatments for autism. Usually autism is a multidisciplinary approach. You need all these three people. Like in Dubai, most of the reports that I have seen from doctors diagnosing autism are those three approaches, three treatments from the ABA, OT, and speech. So there are a lot of others, you know, something like animal therapy, that doesn't work. There is no scientific evidence behind it. Animal therapy, even diet like casein-free, gluten-free, that has no evidence that it reduces the symptoms of autism. If the kid has problem with his digestion system, that's different. And he's getting better and he feels better. Of course, when you're in pain, you can't manage well, you can't behave well. But when your stomach feels good, you are also good. So that's fine. But that is not to reduce the symptoms of autism or to treat the symptoms of autism. Also vitamins as well. I have seen kids on mega doses of vitamin C and vitamin B6 and other vitamins combined. That also doesn't work. Chelation therapy also is not a treatment for autism. Chelation therapy is when you deplete a specific area of the body from blood. So there's a lot of heavy toxic metals in the blood. So you do chelation therapy. Sometimes some people, they die because of that procedure. It has to be done for a specific reason, prescribed by a doctor or under the supervision of a doctor, and done in a hospital. So it has very specific requirements to do chelation therapy. But however, no scientific evidence that it does work. Another one is facilitated communication, that also has been disregarded since the 80s. They stopped using that method, 80s or 90s. They stopped using this method because it has been proven that it's not evidence-based and it does not work.
Yes. Okay, doctor. So for our last question,
Yes.
this is something we actually see. If some parents, they have a child, the child has autism, they then start to think to themselves, what if we have a newborn and he also has autism? So does this really happen? In other words, if my firstborn has autism, are the chances higher that my other children will also be on the spectrum?
Yes, very good question. I also get asked that question a lot by the parent that I meet, because I have recently also met with parents who are thinking to get another baby born. So there are some research and studies that say there is a higher risk if you have a sibling with autism to have another one with autism. So they have identical twins. Even though identical twins, they might have like almost 99 or 90% of identical genes. The autism rate between identical twins is somewhere around 77%. So it's not 100%, it's 77%. So one twin might have autism, another one might not. For fraternal twins, it's 31%, around 31%. And for siblings that they are not twins, there are some age gap between them, it's around 20%. So if somebody has a kid already and they waited like 2-3 years, now we're talking about siblings, the rate is somewhere around 20% chance that the other kid has autism. I know personally some families that they have 4 kids and 4 of them on the spectrum. And I know other families, they have 4 kids, the eldest is on the spectrum and the 3 others are without autism.
Yeah.
Exactly. I know also of twins, both of them, they have autism. And I know other twins, one on the spectrum, another one is not on the spectrum. It's confusing. Nobody knows actually what is this. Nobody knows what it is. Nobody knows what causes it, so that we can prevent it from happening. Nobody knows until now. So I believe that's not one of the questions, is what causes autism. So I won't go there. Yeah, so there is a link. There's also another study that says if you're planning to have a kid, leave at least 3 to 4 years gap in between each kid. You will lessen the probability of having another kid on the spectrum, rather than if you get them like back to back or 1 year after. Like you have a kid, 1 year, another kid. That's not my suggestion. Don't take it from my word. This is the research. This is the research suggestion, is that you wait a couple of years, 3 to 4 years gap in between the kid that has autism, and if you're planning to have another kid later on.
Okay, so by this was our last question. By this, we conclude our second episode of AADMD Talks. I'd like to thank you all for watching. I'd like to once again thank Dr. Bahij so much for joining us today and for this very, very informative interview. Dr. Bahij, thank you so much, and we hope to see you again very soon.
Thank you, Dr. Abdullah, for having me, and what a wonderful platform to disseminate awareness of autism during this month. Thank you so much.
It's our pleasure, Doctor. So thank you all for watching, and stay tuned for our coming episodes.